What are the potential long-term health consequences of intentionally inducing incontinence?
Intentionally inducing incontinence can lead to several long-term health consequences. In this video, we will discuss the following topics. 1. What is incontinence? 2. Why would someone intentionally induce incontinence? 3. What are the potential long-term health consequences?
What is incontinence?
Incontinence is a medical condition where an individual is unable to control their bladder or bowel movements. It can manifest as urinary incontinence, UI, which involves involuntary leakage of urine, or fecal incontinence, FI, which involves involuntary leakage of feces.
Why would someone intentionally induce incontinence?
There are various reasons why someone might intentionally induce incontinence. Some people might do it for sexual gratification or as part of a fetish, while others might do it as a form of self-harm or punishment. Regardless of the reason, it is important to be aware of the potential long-term health consequences of this practice.
What are the potential long-term health consequences?
Intentionally inducing incontinence can lead to several long-term health consequences, including 1. Skin damage and infections. Prolonged exposure to urine and feces can cause skin irritation, breakdown, and infections. These complications can be exacerbated by the use of diapers or incontinence pads, which can trap moisture and bacteria against the skin. 2. Urinary tract infections, UTIs. Intentional incontinence can increase the risk of developing urinary tract infections, as bacteria from the bowel can enter the urinary tract. Repeated UTIs can lead to more serious health issues, such as kidney infections and damage. 3. Loss of muscle control over time. Intentionally inducing incontinence can lead to a weakening of the pelvic floor muscles and sphincters. This can result in permanent incontinence and reduced control over bowel and bladder function. 4. Psychological issues. Intentional incontinence can have psychological consequences, such as feelings of shame, guilt, and isolation. It may also negatively impact an individual's self-esteem and interpersonal relationships. 5. Compromised quality of life. The long-term health consequences of intentionally inducing incontinence can lead to a reduced quality of life. Individuals may experience restrictions in social and physical activities, difficulty maintaining employment, and increased dependence on caregivers. In conclusion, intentionally inducing incontinence carries several potential long-term health consequences. If you or someone you know is engaging in this practice, it is important to seek professional help from a healthcare provider to address the underlying issues and minimize the risk of long-term complications.